Okay, so today's topic will be lung surface impressions. Impressions mainly we'll see the medial view. Okay, so here we'll take the left one, and here we'll take the right one. Okay, so first we'll see the medial view, how the lung is looking like, right? So just draw it. Here you'll find the apex of the lung, then you'll find the anterior border of the lung. Okay, and here you'll find the inferior border of the lung. Okay, and here you'll find the vertebral border of the lung, and this is the apex, right? So
That is right lung, no?
sorry,
That this lung is right one, no?
what I have drawn is the left one. Okay, this one is left, this one will be right. Okay, or you can do it opposite if you will say. Okay, if it is a problem to you, then just erase it. Make it right, and this one will be your left. Okay, right now.
Yes, sir. Thank you, sir.
Okay, so here you'll find the anterior border. Okay, so this is the anterior border over here, right? And here you'll find the uh, inferior border. No, so this is the inferior border and the base, right? So this will become your base. And here you'll find uh, the okay, so this is the hilum area. Okay, and this outer part what I have drawn, this is actually the pleura, right? Because pleura, it is covering whole over the lung, but here at this region, the hilum area, that is not covered by the pleura, because the structures are going in and out, right? So what I have drawn here in this shape, okay, so all this outer part, okay, that is covered by the pleura. So this is the free margin of the pleura, right? So this free margin of pleura, that will be known as your pulmonary ligament. Pulmonary ligament. Okay, and this is the base. Here you will find the apex. Okay, and this is your anterior border. And this will be your, what is that, vertebral border? No. Okay, so this is your whole, no, this whole region, this is the vertebral border. Okay, then here what will find, this is the hilum of the lung. Hilum of lung. Okay, and here you'll find some impressions. So these impressions we'll study just after this hilum of the lung. Okay, so the main thing is that here you'll find the structures what is just going inside the lung and it is just coming outside the lung, right? So what you'll find over here, you'll see that the pulmonary artery, no, that is going inside, and the pulmonary vein that is coming outside the lung. Okay, along with that, the principal bronchus, it is just entering into the hilum. Okay, so just I will show the pulmonary veins over here. No, so here you'll find the two pulmonary veins. Okay, why I have drawn vein in red? Because in lungs it is just opposite. No, pulmonary vein carries the oxygenated blood, right? So here what I'll say, this is your pulmonary vein. Pulmonary vein. Okay, and here you'll find the pulmonary artery. Okay, this is your pulmonary artery. Why I have done blue? Because it carries deoxygenated blood. Okay, from the heart to the lungs, right? That's why. And here, as I have already told you that the principal bronchus before entering in lungs is divided into two, right? Bronchus, right? So these two your apatrial or epiatrial, no, epi or apatrial, arterial bronchus, and it is just below to the artery, right? That's why this one is known as hypoarterial bronchus. Okay, right. So these structures, no, they just enters into the lungs. What they are? The epiatrial bronchus, the epiatrial bronchus, the pulmonary artery, okay, and the hypoarterial bronchus. These three structures that is just entering into the lungs. Okay, along with that, here you will find the pulmonary vein that is just coming outside the lungs. Okay, and after the oxygen exchange takes place inside the lungs, it will just come out of the lungs and it will go towards your what? Your left atrium. No, related to your left atrium, and the pulmonary artery that is related to your right ventricle. Right. So this is the two segments you'll find over here, right? So here the relation it is important, right? Posterior inferiorly we'll find the pulmonary vein, okay, and superior anteriorly we'll find the pulmonary artery, and superior to that you'll find the epiatrial bronchus, and below to this artery you'll find the hypoarterial bronchus. So this relation always it is viva question. It is very important. Okay, so you have to remember this thing. Okay, along with that, here you'll find the two sets of artery. Okay, so this is the bronchial artery. Okay, this is known as your blood supply to the lungs is also needed. No, so how the lungs will function, right? So this is by the bronchial artery. Okay, so the bronchial artery also is going in the bronchus. Okay, so this is the hilum of your right lung, right? Then you just draw another side. No, that is your what is that? Left side. No, okay. So draw here in same way that you'll find the apex over here. No, Then you'll find the posterior border. Okay, then you'll find this is the base, right? And from here you'll find the anterior border. Okay, and the nodes over here, and then it's going like this, right? So this is the vertebral border, right? This is the vertebral border. Okay, and this will become your, what is that, your base, no? So this is the base over here. This is your border is like this one, right? And here is the apex. Okay, and here is your anterior border. Okay, and here is the base. Okay, and this is the mediastinal surface, right? Because all this is the medial surface, but this is vertebral surface, and this is the mediastinal surface, right? Now here we will draw again the hilum, no? So this is the hilum over here. Sorry, this is your, what is that, your pulmonary ligament, no? The presence of your pulmonary ligament over here. Okay, and at the below, what you'll find? You'll find the two sets of pulmonary vein, no? So this is a pulmonary vein, and here we'll find the artery. That artery will be the pulmonary artery. Okay, so here you'll find the pulmonary artery. Okay, along with that you'll find the one only principal bronchus. Okay, only one principal bronchus that you'll find at this point, right? So this is the principal bronchus. This is your left pulmonary artery, and this is your left pulmonary vein. Okay, so only here you'll find these structures. The epiarterial and hypoarterial will be absent here. Only you'll get the single pulmonary what is that, your sorry, okay. Along with that, only a single bronchial artery. You'll find double bronchial artery, but here you'll find only the single bronchial artery, right? So this is the left lung, right? Now we'll see the impressions. What are the impressions? Okay, so first here we'll see the impressions of your lung, right? Because in impressions of left lung, what will happen at this point? You'll find the ascending. Oh, sorry. Okay, here you'll find the ascending aorta. No, this is the impression for ascending aorta, and here you'll find the impressions for arch of aorta. Okay, impression means what? You'll find the depression over there. No, and that depression will shows that is the impression for arch of aorta. Okay, along with that, here you'll find the impressions for your brachio. So this is the left side, no? So you'll find the left what is that? Which artery it is?
Subclavian.
Yes, this is the, you'll find the left subclavian artery, right? And posteriorly you'll find that is just descending downward. Okay, so here whole over the things you'll find the thoracic aorta. Okay, or you can say it is the descending thoracic aorta. Okay, so this is the first impression. Okay, what is that? Anteriorly we'll find the ascending aorta. Okay, and at the superior side you'll find the arch of aorta impression. Okay, and posteriorly you'll find, means impression means what? A groove, right? Groove will find, right? So posteriorly we'll find the uh, descending thoracic aorta. Okay, and just anterior to this one you'll find the presence of your esophagus, right? So at this point you'll find the impression for the esophagus, right? And this esophagus that is just descending downward, okay, in this manner. Okay, and anterior, here it will be anterior. See the relation here, it becomes posterior to the artery, right? Because the esophagus, it is just behind to the trachea. No, then this esophagus descends downward, and the thoracic aorta goes backward to the esophagus because it has to pass through the T to T12 vertebrae, right? And the esophagus, it is coming anteriorly and towards the left side, no, to go into the abdominal cavity through the T10 vertebral level, right? So here you'll find the esophagus impression, and here you'll find the descending thoracic impression. Okay, and at this point you will find the presence of your subclavian vein also. Okay, you will find the impression for the subclavian vein. Okay, then just anterior to this one, here you'll find this anterior border, right? So at this anterior border you'll find there is the nerve, no? So this nerve, it is just descending downward and backward, no? What is this nerve? This nerve will be the phrenic nerve. Okay, so at the medial surface of the left lung anteriorly you'll find there is a impression, no, that actually lodges the phrenic nerve. Okay, like that posteriorly you'll find here, no, here you'll find another nerve that is just going posterior to the hilum, right? So this is your vagus nerve, presence of your vagus nerve. Okay, so this is your vagus nerve, this is your phrenic nerve. Okay, and here you'll find at the apex you'll find three impressions. They are the subclavian vein, subclavian artery, left subclavian artery, and the esophagus, right? And just below to that you'll get one impression, that is for the arch of aorta. And at the posterior side, most posteriorly you'll find the descending thoracic aorta, and anterior to that we'll find the esophagus groove or esophagus impression. Okay, so this is your total mediastinal surface relation and the impressions that is present in your left lung. Okay, so like that you just come to the right lung. Okay, so this is your right lung, no? So at the right lung what you'll find here, you'll find, you can see that this esophagus actually it is coming towards the downward, no, it is coming downward. So at this point, at the lower part of the right lungs, okay, you'll find the impressions for your esophagus. Okay, at this point you'll find the impressions for esophagus. Okay, and also at this point you will find there is the presence of vein, no? Which vein? Here you will find the superior vena cava. Okay, this is your superior vena cava, right? And here you will find the impressions for the brachiocephalic vein. Okay, you'll find which brachiocephalic vein? This is your right brachiocephalic vein. Okay, and here you'll find the external jugular vein. No, here you'll find the external jugular vein. Okay, uh, but you just do one thing, because external jugular, sorry, I have drawn wrong here. Okay, because here you'll find this one is subclavian vein, and the what is that? This is internal jugular vein, and this is subclavian vein. They makes here the brachiocephalic vein, and this brachiocephalic vein, it drains to the superior vena cava, right? And here you'll find another, that is the azygos vein. No, the azygos vein, that is draining to the superior vena cava, right? So this azygos vein, it is making impression over here. Okay, here you'll find what is that? Arch of aorta at the left lung, but at the right lung you'll find the presence of your azygos vein. Okay, and this azygos vein, that is going posterior to the what is that? Esophagus. Okay, and it is just running downward in this way. Okay, so here you'll find the anteriorly, you'll find the superior vena cava of the right lung, and here you'll find at the apex. Okay, like here you'll find the brachiocephalic vein. Which brachiocephalic? Right brachiocephalic vein. And just above to that you'll find your left, right subclavian vein and right internal jugular vein. Right. And just below to this you'll find, so this is the inferior vena cava impression. Okay, at this point you'll find the impressions, okay, for the inferior vena cava, right? Because here this is the position for the right atrium. Okay, the position for right atrium. Okay, so this is impression for right atrium. Okay, and this is your inferior vena cava, and this will be your what is that? Right brachiocephalic vein. Okay, and this is your inferior, sorry, superior vena cava. Okay, this is superior vena cava, and this is your esophagus, and this is your azygos vein. Azygos vein. Okay, so the left lung and the right lung, along with the hilums and their structures. Any doubt? And no doubt here you find which nerve line here, which nerve this is? Phrenic nerve. No, which phrenic? Right phrenic nerve. Okay, and here you'll find the, okay. So this is the right vagus impression, and this is your left uh, right vagus impression. Clear? So this is all about the lung surfaces impressions. Medial surface, you know, margins, no, costal impressions. That's all, nothing more than that. No, that's not important. This structure